The FDA is looking to take action against BHA, which is an additive used in processed meats and breads. FDA Commissioner Dr. Marty Makary joins me now. First of all, Doc, what does BHA do and why are you thinking of banning it?
Well, good morning, Stu. It is an antioxidant preservative. It's commonly found in glues and plastics and other products, but it's also in foods. It's in about 4,600 commonly consumed foods in the U.S. food supply. There have been a number of concerns about it, including the National Toxicology Program in the United States did say that it is likely a carcinogen, that it's entirely appropriate that this will be anticipated to be a carcinogen as more research comes in. So a lot of parents are concerned about it. So we are going to issue a request for information and take a close, hard look at it, along with BHT, which is a common molecule you'll see on the label of cereals. BHT is banned in some countries. You can get fined $140,000 for making cereal with BHT in some countries. And the other is azodicarbonamide. This is a chemical that is used in shoes and yoga mats to make them more fluffy, to create more cushion by adding those sort of bubbles in yoga mats and in sneakers. But it's also used in dough for food. So we're going to be taking a look at that as well.
If there's any doubt, ban it. Okay. Doctor, the New York Times editorial board is calling for guardrails on marijuana. They originally backed legalization. My problem here, Doctor, is trying to keep vapes out of the hands of teenagers. I think that's the most dangerous thing about legalized marijuana. But my question again is, how do you get vapes away from teenagers?
Well, first of all, we've seen a dramatic increase in teens vaping with THC, that is marijuana, in the last administration, in the 4 years prior to us coming into office. So we're taking this very seriously. And we're trying to understand this field of science with better research. Do you know that the marijuana today is not the marijuana of hippies? Sure. It's 10 to 20 times stronger. And new research is showing that its effect on the developing adolescent mind is different than in an adult. And in a young person, it can result in psychosis diagnoses later in life. So we are taking this very seriously, and it is a controlled substance in the Trump administration. And so that's the state of affairs.
Cannabinoid hyperemesis syndrome. You're seeing a lot of that, and that's intense vomiting and stomach pain, especially in youngsters who've been using constantly marijuana. That's what you see, isn't it?
Yeah, those are side effects. And I think if you simply talk about the dangers of marijuana in kids in terms of risk, remember, risk appeals to many kids. So we have to talk about what it does to their ability to compete in a track and field match and what it does to their day-to-day sort of vitality. It creates fatigue and it creates problems with learning and judgment. So we have to talk about that. We are also in the Trump administration very serious about making sure that the medicinal purposes, that is the indications where people find benefit in medical conditions, for example, with chronic terminal cancer, that is advanced. And so we've taken action to change the scheduling from Schedule 1 to Schedule 3 as a controlled substance.
Last one, Doctor. Moderna says that you refused to review their application for their mRNA flu vaccine. What's the problem?
Well, this is part of a conversation that occurs with all drug makers when they don't follow the recommendations in the guidance by the FDA. Some say that the trial that they conducted was unethical because they randomized their new mRNA flu shot in people over 65 to a worse than standard of care flu shot, an older flu shot. We now know that seniors, the standard of care is a high-dose flu shot. And so they did not use the high-dose flu shot in the control group as the FDA had recommended they use. So they're going to probably come back. They can come back and file the application. Perhaps they'll break it up into 2 subgroups based on the age categories. But this is the normal back and forth dialogue that the FDA has with companies, especially when they don't follow the guidance.
FDA Commissioner Dr. Marty Makary, thank you very much indeed for joining us this morning.
Thanks, Stu.